Hi, this is Yannick again, Yannick Densis, the nurse practitioner. Today it's April the 4th, 2023. We are going to, our teaching today will be about disorders of the brain and nerves. To start, I would like to greet everyone, and also do not forget that the main purpose of this video is about education, is to teach you about health promotion and disease prevention. So once we know, about the diseases, the symptoms, so at least we can have an idea when to get help if that occurs. We're going to start with, let's start with God's words about healing. If we go to Acts in New King James Bible, Acts 14 verse 8-9, what it says, quote, "In his Lystra, a certain man without strength in his feet was sitting, a cripple from his mother's womb, who had never walked. This man heard Paul speaking. Paul, observing him intently and saying that he had faith to be healed." So this is God's word about healing. So the disorders of the brain and nerves is, we have many of them. It's so complex, it's complex, and some of them is still not well understood. So you can follow with me with those slides. So when we are dealing with the disorder of the brain and nerves, first of all, this is specialties disorder. So the specialist you need to go see, it's the neurologist. Is the doctors who has specialized in brain and nerves. Okay, so this is most depending of your health insurance. If you're in United States, your primary care provider will refer you. So let's say if you have HMO, you need your primary care provider to refer you to a neurologist. But if you have a PPO, you can, just go ahead and, you can ask around which one, which neurologist is well known in the community, and you can call your health insurance, and you can go and see one if you need one. If you need, if you have any symptom you think that is relating to your brain and nerves, so you can go and see a neurologist. So this is the specialist who treat the disorder of the brain and nerve. So what are those disorders? So in that category, we have many of them, okay? So as you see, the first one is multiple sclerosis. This is how we call for short-term MS. We found stroke. They have meningitis, encephalitis, Parkinson's disease. We have epilepsy or seizures. We have Guillain-Barré syndrome. Shingles is one of them also. Neuralgia, migraine, headache, fainting, and dizziness. All those disorders, they are related to the brain and nerves. And the doctor you need to see for those disorders, again, it's a neurologist, because those kind of doctors, they will do intensive examinations, for your nerves and everything, so they can really diagnose you what you really have. Let's speak about multiple sclerosis. What is multiple sclerosis? Multiple sclerosis is a chronic disease of the nervous system in which the protective sheath, they said, that cover the nerves become inflamed and scarred, resulting in loss of nerve function. So that's what they said. That's what multiple sclerosis is. So the initial attack is usually followed by recovery. So the initial attack usually we can recover by this attack, but sufferers inevitably experience a cycle of remission, sometimes for years. So you can have it, you have your first attack, and you don't have it for years, and the relapse will steadily increasing neurological damage and disability. So they said the degree of improvement after each attack decreased, and the physical disability is usually progressive. So after each attack, this is like stroke. After each attack you have of this disease, your disability will become bigger. Eventually, there may also be in intellectual impairment also. So they said MS can also affect your intellect. So what caused it? No one knows. Okay, the researchers doesn't know what caused it. So sometimes they say, some researchers said it might be infection, like if somebody has viral infections, and after that can precipitate that. But really, this is one of the disease. It's nobody really can know. No one really knows exactly what caused it. Let's talk about some data about MS. In the US, cases are usually diagnosed between age of 20 to 40. So this is, they are young. This is young adult who diagnosed with that. Multiple sclerosis is not an inherited disease. So that's meaning it's not like from, your family member who has it and then you have it. Although they said, but a predisposition may run in your family, even though it's not, it doesn't pass by generation to generation, but the research shows that it might, you might see it, it might run. So again, the cause is unknown. Some researchers said that it's an autoimmune disorder, autoimmune disorder. That's meaning your own cells is fighting your own body. So, your own cell is destroying your own body. That's what they meant by autoimmune disorder. Also, researchers believe that, like I said before, viral infection may trigger multiple sclerosis. Multiple sclerosis is more common in temperate climates, and it's rare in Asia and Africa. So, which led to the theories it might be related to diet or climate. So even though the researchers said that multiple sclerosis, the cause is unknown, but they speculate that because it's more, they found that disease, which is MS, is rare in Asia, in Africa. So they have theories who said that it might be related to your diet or climate. Because of lack of persistent symptoms, many multiple sclerosis patients go for a number of years before they are diagnosed. So you can have MS for years and you don't even know it. And after once those symptoms develops, that's when you go to see your neurologist, and then they can discover that. Average life expectancy after onset is over 30 years. So that's meaning your life expectancy. So how long you are going to live after you first diagnosed from multiple sclerosis is over. So it's more than 30 years. But some patients can die a few years of onset, and others others can survive more than 50 years. So it depends how progressive is the disease. If multiple sclerosis is it's a slow, if the type that the person has, this is a slow MS, so that person can live longer. But sometimes we found that one type is very is very fast, so that person can be diagnosed, like, let's say, this month, and then after 6 months that individual it's in wheelchair. He cannot even walk. So that's fast. This progression is fast. What are symptoms of MS? The symptom of multiple sclerosis: limb weakness, visual deterioration. So that's meaning poor vision. Your vision is become weaker. Particularly, they said, in the center of the visual field. So this one, it's your eye doctor can determine that. If you have a vision problem, so you go to optometrist or ophthalmologist. They are the one who's going to do some examination, and they can see if your center of visual field, they are affected. And also you can have, the symptom can be double vision, loss of sensation. So sometimes you cannot feel, with your fingers. You cannot feel with your feet. Staggering and impaired speech. So those are symptoms for multiple, can be, symptom for multiple sclerosis. Again, the specialist who can diagnose you for that, it's a neurologist. And also facial paralysis. Facial paralysis, we cannot, we have to be careful not to confuse it with Bell palsy. Okay, so that's why it's very important. Once you have those symptoms, you go to see your specialist, and he's the one who's going to distinguish if you have MS or something else. Treatment for MS. So again, the treatment for MS, it's you have to follow closely with your neurologist. Oh, I'm sorry. This one I said consult ND. It's not ND, it's MD. You have to consult your MD. And also, it's a good idea as well. Also, you can consult a dietitian also. So you know that the dietitian will help you to choose what kind of food you can eat. You know, once you have that disease. The literature review said that people with multiple sclerosis can eat plenty of food that contain gamma linoleic acid, which is found in sunflower and safflower oil, evening primrose products. So this is, you know, kind of your natural stuff. And also they advise you also, once you have multiple sclerosis, also vitamin B12, vitamin B6, B3, folic acid, vitamin C, in your vitamin E, the minerals, your zinc, your magnesium, all those minerals and the vitamins, they are strongly recommended. So again, of course, you have to work closely again with your neurologist. You know, if you take vitamins, let him know that he can advise you. And also you can do your own research, because nowadays, you know, with the YouTube, with the computer, there's a lot of information you can find yourself. But always it's good to consult with your physician, who can, you know, guide you what to do. So I'm going to stop now with multiple sclerosis, and my next video we will be talking about stroke, meningitis, and encephalitis. So on that, hopefully that topic or the video has helped. Or if you know someone who has multiple sclerosis, so you know, just encourage, just encourage that person, you know, to follow up with his or her neurologist closely, because they have a medicine, you know, they can give, which can slow down the progression of the disease. So on that, I wish you best of health. Bye-bye.